On June 12, 2020, Fu Xueji, widow of Dr. Li Wenliang, posted a message on WeChat. Dr. Wenliang was one of those early Chinese doctors who alarmed the world in January 2020 of new disease COVID-19. Treating COVID-19 patients, he too contracted the disease and died on February 7, 2020. Within a few days after the epidemic outbreak in Wuhan, China, the virus spread in many nations across the world. Hundreds and thousands of doctors, nurses and other healthcare workers were put on the front line. In many countries, healthcare workers were faced with acute shortage of masks and personal protective equipment kits. Lack of sufficient ventilators for their patients made them frantic. Except a few nations like New Zealand, many countries blindly followed Chinese model lockdown. In Italy, about 17,000 health workers were infected and more than 100 doctors died. More than 10,000 health workers were reportedly infected in Iran, and a structure has been unveiled to honor their service. Mary Agiva Agiopong from Ghana was 28 and heavily pregnant when the virus killed her. She was a nurse with the NHS in the UK. Luckily, her baby daughter was saved by cesarean section before mother's death. The virus is killing Brazilian nurses faster than anywhere else. Nations in the African continent are collectively combating the pandemic. Africa CDC have deployed 164 healthcare workers who will be supported by 1 million community members. Dr. Frank Gabrin was the first American emergency doctor who succumbed to COVID-19. In the US, more than 600 health workers have died. Globally, around 100,000 healthcare workers are believed to have been infected. And a few creative souls managed and had their experiences and stories randomly posted on social media or published in mainstream media. But what about the stories that still remain untold?